Welcome to DX Media, where education, information, and our general well-being is extensively considered important. Disclaimer: the information in this article cannot and should not replace a medical consultation and must not be used for self-diagnosis or treatment, but rather clinical awareness or public health. When you're pregnant, there's so much that you can do to maximize your chances of success. How do you and what do you do afterwards? I'm here to tell you what matters and what doesn't matter. So, talking. Getting pregnant can seem like a marathon, and the egg has to be released at this perfect time. The fallopian tubes, which are not attached to the ovary, must pick up the egg and somehow get it into this perfect spot in the fallopian tube where there are plenty of sperm available, and if it manages to fertilize the egg now becomes an embryo, and that's how you get pregnant. All of them sometimes sensitive that essentially getting the timing right and figuring out your 4-day window and your ovulation are the two key ways that you can actually get pregnant in a timely manner. Your fertile window period essentially is 6 days leading up to ovulation. You're most likely to get pregnant in the 2 to 3 days leading up to ovulation. So you have a 28-day cycle. Day 1 is the day that you start your period. You're probably ovulating somewhere around 14 to 16, which means going back to my earlier suggestion about the fertile window being 6 days before ovulation. What you can do is you can start to have intercourse every day, every other day, beginning on date 11, 12, 13, 14, 15, 16, or you can begin to have intercourse on day 9, 10, 11, 12, 13, 14. If having sex every day is your jam, go for the day. If that's much more convenient to you than you do that, by all means, I wouldn't worry about how many times a day. Essentially try to get sperm in during that 4-day window. The second you can do is you can use ovulation predictor kit : these are essentially little strips that detect that early surge in the brain. So what you have to do is you buy this strip. Upon this strip, and typically ovulation supposed to take place within 24 hours of, that strip turning positive. However, here's the caveat. Sometimes ovulation takes place 2 days after that strip turns positive, and 7% of the strips on the market can have a false positive. So you might want to just take into account some of these downsides when you're looking at the ovulation predictor kits. The other thing is basal body temperature. That's essentially measuring your body temperature first thing in the morning before getting out of bed. And typically after ovulation, there is a rise or a bump up in your temperature. So you can use that information to track when is it that you think you've ovulated. One more, your cervical mucus : so essentially vaginal secretions, especially around the time of ovulation, get really slippery and wet. That is a good sign of, fertile cervical mucus. And again, that would be a good indicator of when you ought to have intercourse. Complete full disclosure: you do not need a fertility-friendly lubrication to be able to get pregnant. If you for reason have vaginal dryness or sex is painful and a lubricant is needed, only then, go with a lubricant. So in terms of lubricants, essentially the water-based lubricants are really not recommended. If you had lubricant, I would typically recommend anything that is mineral oil-based or some of those fertility-friendly lubricants on the market. And if you look at their ingredients, you typically find hydroxyethyl cellulose mentioned in those ingredients. Number 1: is that you have to lay down after having intercourse and not pee. Get up, go pee, do whatever it is that you need to do, and laying down has not been shown to improve your chances of conception. The number is positions: any position that gets sperm into the female genital is a great position. So do not feel like you have to go out and discover a new position that gets you pregnant faster. Oh gosh. Legs up after intercourse. I mean, if that's something that you like to do, by all means. But don't feel like you have to do that just so that you can get pregnant. And as female orgasm goes, that's wonderful. But that's not necessarily going to help you get pregnant. Sperm are pretty good at getting up to the fallopian tubes. They've seen that when there are sperm present in the cervix, they get into the fallopian tubes within 15 minutes. And then, guess what? They don't stay in the fallopian tubes. These sperm actually get into the peritoneal or the abdominal cavity. So sperm are pretty good about finding their way to where it really matters, things that you can do to optimize your fertility before you're trying to get pregnant. Number 1 mistake: a prenatal vitamin containing folic acid: folic acid has been shown to prevent neural tube defects in your baby. So please do that. That's super duper important. Smoking's a big no-no: that is beyond any doubt has been shown to have an effect on fertility or on miscarriages. So smoking is something that I absolutely would ask you to quit or not recommend in the least bit. In terms of caffeine, the dieters gets a little bit hazy with caffeine. Light to moderate caffeine use is probably okay. And I'm going to qualify this when I say like to moderate. I mean less than 2 cups of coffee a day. So, and this is assuming that you get your caffeine only from coffee, not from tea, not from chocolates, not from other sources. So essentially like to moderate caffeine uses, probably, okay. And as alcohol goes, saying you obviously don't want to consume any alcohol when you're pregnant. But leading up to pregnancy, any sort of very light drinking is probably okay, less than 2 drinks a day. And, honestly, if you want to be extra prepared and stop drinking alcohol completely, that's fine. Do it. In terms of exercise, they've shown that moderate exercise is good for patients. So, a healthy, well-balanced diet, moderate exercise, all of that's completely compatible with trying to get pregnant. All the information that I've given you is essentially based on the fact that you have normal regular cycles. However, if you don't have normal regular cycles, this is a great time to seek medical help. Ask a fertility specialist on how they can help you obviously to regulate your cycles. If you found the video helpful, be sure to like and share this video with those who might benefit from it. Kindly subscribe to SmartDX Media and hit the notification bell icon to get notified whenever we post a new video. If you're 35 and you've been trying to conceive for a year and haven't had any success, great time to call in fertility specialist. If you're 35 and you've been trying to conceive for 6 months and haven't been successful, good time to call a fertility specialist. But if you're 40 and you've been trying to conceive for a couple of months and that hasn't worked out for you, please visit www.smartdxmedia.com fertility specialist section right now for more update or information or support. So endometriosis, or if you have received radiation or chemotherapy, or if you have a history of known scar tissue in your pelvic cavity, one of those are excellent reasons for you to seek help accordingly. Thanks so much for watching, and we'll see you in our next video. Kindly subscribe so that each time we release new video, you will be among the first contacts notified. Thank you as you do so.